What if I told you that there's a medication that could reduce your pain, lower your crisis, and give you something close to a normal life? But you've been too afraid to take it. I understand that fear because I had it too. I was told it's a chemotherapy drug. I was told it could have serious side effects. I was even told it might cause cancer. And yet, I've been on hydroxyurea for nearly 20 years. And today, I'm going to tell you the truth, my real experience, the fears, the side effects, and what it actually did for my life with sickle cell. Let's be honest, hydroxyurea is one of the most misunderstood treatments for sickle cell disease. A lot of people in our community are afraid of it, and not without reason. When you hear chemotherapy drug, your mind immediately goes to cancer, to damage, to risk. You start asking questions like, what is this doing to my body long term? Am I trading one problem for another? Is this actually safe? And sometimes, even family members discourage it. Friends question it. You hear stories, some true, but some not. So instead of hope, you feel hesitation. And that hesitation is real. I had it too. So, what did my life look like before hydroxyurea? Before I ever started hydroxyurea, my life with sickle cell was unpredictable. Pain crises were frequent, not once a year, not twice, but every few months. And if you know, then you know. Those aren't just bad days, those are days where you can't move, you can't think straight, you're just trying to survive the pain. Hospital visits became normal. Plans often got cancelled. Peace was rare. And mentally, it takes a toll because you never know when the next crisis is coming. You are not just living life, you are managing pain. I was first introduced to hydroxyurea in China, and at that point, things had gotten really bad. The crises were happening too often. My body was exhausted, and I was at a point where I had to make a decision, stay in the cycle I was in or try something I was afraid of. And I won't lie, I didn't start it confidently. I started it cautiously, with questions, with concerns, but also with a little bit of hope. So here's what hydroxyurea actually did for me. And this is where everything began to change. After starting hydroxyurea, my crisis didn't disappear overnight, but they reduced significantly from every few months to about 2 to 3 major crises a year. That alone changed everything. But it didn't stop there. My hemoglobin levels improved. My energy improved. My body wasn't constantly fighting itself the same way. And one of the biggest things, hydroxyurea helps reduce the sickling of red blood cells. And if you understand sickle cell, that is huge because less sickling means less blockage, less pain, less long term organ damage. And for me, it meant I could finally experience something I hadn't had in a long time, a near normal life. Not perfect, but better, more stable, more manageable. Now, let's talk about what everyone really wants to know, the side effects, because this is where most of the fear lives. For me personally, after nearly 20 years, I have not experienced major side effects. The only noticeable change is the darkening of my skin and my nails. That's it. No severe complications, no life threatening reactions, no falling out of my hair. Now, this is important. That doesn't mean that everyone will have the same experience. Some people try hydroxyurea and feel like it didn't work for them. Others may experience side effects, and those stories matter too. But my story has been overwhelmingly positive. Let's address the biggest fear directly. Yes, hydroxyurea is also used in cancer treatments. And because of that, some doctors will mention a potential cancer risk. And hearing that is enough to stop a lot of people immediately. But here's my reality. I've taken hydroxyurea for almost 2 decades and I'm still here, still living, still benefiting from it. For me, the benefits outweighed the fear. Now, here's my biggest regret. If I could go back and change one thing, I would have started hydroxyurea much earlier because I spent so much time in pain, in fear, in hesitation when there was something that could have helped me sooner. I have a friend whose son also has sickle cell anemia. He was lucky enough to start hydroxyurea when he was just a little boy, and that has preserved him from frequent crises, giving him a near normal life. But most importantly, it has reduced a lot of organ damage. I, on the other hand, because I started hydroxyurea so late, many of my organs were already damaged. I ended up with hip bone necrosis on both hips, and I had a hip bone replacement in 2019 of my left hip, and I'm waiting to have my right hip bone replaced as well. I've also had other damages in my body, such as issues with my heart, an enlarged heart, my lungs, my eyes. So that's my only regret. Because if I had started taking hydroxyurea when I was really young, I believe that I could have minimized a lot of the organ damage that I suffer from today. But the good thing is, now that I'm on hydroxyurea and the sickling and the crisis have reduced, the damage to my organs is also or has also reduced. However, what has already been damaged cannot be reversed. So here's my final encouragement. If you have sickle cell disease and you have access to hydroxyurea, I'm not here to pressure you, but I'm here to tell you, don't let fear be the only voice guiding your decision. We do not live by fear. We have to live by faith. That's what the Bible says. So ask questions, talk to your doctor, do your own research, and listen to real experiences like this one. Because for me, hydroxyurea didn't just reduce my pain, it gave me part of my life back. If you've tried hydroxyurea or you are thinking about it, I'd love to hear your experience in the comments because your story could help someone else make a life changing decision. And if you want to understand the bigger picture, not just medication, but what actually helped me survive and keep going, watch this video next. It's titled 49 Years with Sickle Cell Disease, How I Am Still Here and What Actually Kept Me Alive. I'll link it right here because hydroxyurea was part of my journey, but it's not the whole story. And what I share in that video might change how you see your own. I'll see you in the next video.